Insmed just got the kind of trial result that can quietly reshape who's eligible for a drug already on the market. The company's inhaled antibiotic Arikayce, generically known as amikacin liposome inhalation suspension, just hit every major endpoint in a Phase 3b trial called ENCORE, and the results, presented as late-breaking data at the American Thoracic Society's 2026 conference, could dramatically widen the population of patients who qualify for Insmed's Arikayce. To understand why this matters, you need to understand how narrowly Arikayce is currently allowed to be used. Right now, Insmed's Arikayce only has accelerated approval for what's called refractory MAC lung disease, meaning Mycobacterium avium complex lung infections that have already failed at least 6 months of standard multidrug antibiotic therapy. In other words, under the current label, a patient has to fail first-line treatment before Arikayce is even an option. It's a last resort drug, not a first-line one. The ENCORE trial tested something much bolder, giving Insmed's Arikayce to patients right at diagnosis, before they've ever been treated with antibiotics for MAC lung disease at all. Insmed enrolled 425 adults with newly diagnosed antibiotic-naive MAC lung disease across multiple countries in a randomized, double-blind, placebo-controlled design. Every patient received standard multidrug background therapy, azithromycin and ethambutol, and on top of that, half received once-daily Arikayce and half received an inhaled placebo made of empty liposomes for 12 full months. The results were clean. Insmed's Arikayce met its primary endpoint, and every single multiplicity-controlled secondary culture conversion endpoint in the trial. Patients getting Arikayce alongside their multidrug background therapy showed significantly greater improvement in respiratory symptom scores compared with patients on the multidrug therapy plus placebo, measured out to month 13. For a disease that can grind on for months or years and slowly erode lung function, a clean win across both symptom improvement and the ability to actually clear the infection from culture is exactly the kind of data pulmonologists treating MAC lung disease have been waiting for. That is the story of Insmed's Arikayce ENCORE, Phase 3b trial results in antibiotic-naive MAC lung disease at ATS 2026. Add your perspective in the comments, share this story with a colleague, and subscribe for the next ConferenceHype narrative.